are fucking live. You guys are gonna shit magnetic nanoparticles in the vaccine, dude. It's called Polymag, made by a company called Chemicell. By the Germans, no doubt, in Germany. All right. Get that out of the way. Cut that screen share down. What are you doing, Almond? Doing all right? Yeah, you're gonna shit. And I pulled up so much information on this. All right, so I don't want to fucking see me. It's goddamn 2:30 in the morning. I ought to be sleeping. All right, so I'm gonna cut chat here so we can see. Get a screen share going. Audio, because there's part of a video here. Cut the background music. This is that. That's the normal music I'm going to play. This I was going to play to see what it was, but we'll get to that. Well, it's on YouTube, so it ought to be okay. Yeah, I'm going to play this real fast. Start this off. It's not getting any better.
It's a beautiful mountain time. You know, it's all over the news, especially local news. We got the drought watch. We got food supply issues. We're going to have transportation issues because everything's going up in price, including fuel.
This is just to get you worried about other shit before I freak you out with the fucking...
Survival Living did a video this morning saying that a lot of these people that are getting hired, new hires, for unskilled workers at these real high wages are going under a 90-day probationary period, and after 30, 60 days are told, you know what, you're just not what we thought you would be, and this is all we can pay you now. And the middle class, the people that have remained working, the people who have not seeked out a new job, but the people who have remained working are not getting raises. Everything's going up in price. It's not getting any better, and it's going to get far worse. Far worse. Then we got issues like this. We got Iran in the Atlantic heading towards Venezuela. Now, I don't know if Iran has any subs, but if they don't, I'll guarantee you they're being followed by China or Russia. And whether they're bringing food, supplies, aid, fuel, or arms is pretty much unknown. But why would they have them there? There's been all kinds of talk about China thinking bad thoughts about us and coming over here. And now we have Iran going to Venezuela. Is Iran really that worried about Venezuela? Why would Iran be that worried about them? Just don't make sense. You really need to start thinking about your security, and there's many people out there that either because of their local laws, their past criminal history, whatever, cannot afford to protect themselves in a standard manner. So we're getting a couple of low cost crossbows. We're going to check them out. I'm going to do a review on them, see how they work. And we will definitely let you know on that as soon as we get them. That might be another way to go. Either way, we're going to like it because it's really quiet. 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 Yes. That's all. That's all she wrote. We'll see. The other thing I want to suggest you guys get, they're not that expensive on Amazon, under $30. I don't know how much they are at your local pharmacy or Walmart. I would imagine they're pretty cheap. And you can usually find them at garage sales really cheap too. Get yourself a pair of crutches. Even if you sprain a foot, well, if I sprain a foot, I'll just walk on it. I'll be all right. I'm going to walk it off. Well, let me tell you, if you have a pair of crutches, that sprain may heal up in a week. If you continue walking on it, that sprain may heal up in a month. Consider getting a pair of crutches. I'm out for the rest of the day unless something big happens. Wishing you all well. Plan ahead.
All right. So, plan ahead, blah, blah, blah. Turn the volume up here a little bit. Now, I'm only going to play part of this because it's from BitChute. Magnetism intentionally added to shot to force mRNA through entire body. It's and we'll get to the papers, the papers and stuff here in a minute. You see everything I've got brought up on the fucking bar up there? Yeah. So I've been a busy little beaver.
So let me share something else with your audience. There's a company on the internet, and one of many, by the way. I've been doing all my digging. It's called Chemicell. It's in Berlin, Germany. They advertise, Stu, all kinds of products. There are hundreds of components that you can use to create these magnetic fields around your molecule, right? You can buy it in 200 microgram vials. It's called Polymag. And I want to share with your audience the disclaimer on Chemicell's website in case you want to buy a little bit of these magnetic fields and attach them to mRNA before you stick them into the human race. And I quote the company: the transfection reagents and all of its components are developed, designed, intended, and sold for research use only. And here's the frightening part, Stu. They are not to be used for human diagnostic or any drug intended for humans.
And this is in these so-called vaccines.
These components are what they use, Pfizer and Moderna at least, used in their injections in these vials. This is why you have to get an informed consent.
All right. I'm not saying, I'm not condoning anything she just said about the informed consent or anything. I'm not giving medical advice here. I'm just proving that we're going to prove that it is in the injection. But we'll get back to this later. We're going to prove right now that it can do a mic test real quick. Almond, can you hear me? Snooze button. Snooze button. Hey, Almond, snooze. Can you hear me? Can you hear me? Can you hear me? Hear me at all? Okay, you can hear me? Okay. So we're going to prove that's the magnetofection is what it's called. That's the Chemicell. magnetic core matrix. Anyway, we're going to prove there's magnetic nanoparticles formed from alpha nano materials. This is an article about alpha virus derived replicon RNA vaccine induces SARS-CoV-2 neutralizing antibody. So there's a lot of stuff about it helping to neutralize viruses and testing for viruses. There's a magnetic particles. Where is that? That's what it looks like. That's what your cells look like after the magnetic nanoparticles get into your cells. It turns them from transparent to dark. It's, it's like gold coated magnetic nanoparticles comparison. Sorry guys, it's late. So tracking. Here it is right here. This proves that the and it's in the description of the video too, the little part. Uh, and we'll go back up and reference this. Encapsulated in liquid nanoparticles, LNPs. Okay.
BNT162b is a mRNA vaccine for prevention of COVID-19. The vaccine is made of a mRNA encoding for the full-length SARS-CoV-2 spike glycoprotein, S, encapsulated in lipid nanoparticles, LNPs. The sequence of the S protein was chosen based on the sequence for the SARS-CoV-2 isolate RUNHU1, which was available when the program was initiated. GenBank MN908947.3, Complete Genome, and GenBank QHD43416.1, Spike Surface Glycoprotein. The active substance consists of a single-stranded, 5-capped mRNA that is translated into a codon-optimized sequence encoding the spike antigen of SARS-CoV-2. The RNA contains common structural elements optimized for mediating high RNA stability and translational efficiency. See section 2.2. The LNPs protect the RNA from degradation by RNase and enable transfection of host cells after intramuscular (IM) delivery. The mRNA is translated into the SARS-CoV-2 S protein in the host cell cytosol. The S protein is then expressed on the cell surface where it induces an adaptive immune response. The S protein is identified as a target for neutralizing antibodies against the virus and is therefore considered a relevant vaccine component. The vaccine, BNT162b2, 30g, is administered intramuscularly, IM, in 2 30g doses of the diluted vaccine solution given 21 days apart. Intended indication, active immunization to prevent COVID-19 disease caused by SARS-CoV-2 virus in individuals 16 years of age and older.
Now, this, you hear that? In individuals 16 years of age and older, the vaccine was never meant to be administered to anyone younger than 16, guys. And they're giving it to children as we speak, and they're dying. The lipid nanoparticles, the LNPs, are the magnetification polymag nanoparticles, magnetic nanoparticles. Okay, that are experimental. That's why they don't mention it that much here, and they call them LNPs. The only part it says that is that the is Where's it at? Degradation. It's for the RNA contains common structural elements optimized for mediating high RNA stability and transitional efficiency, efficiency, or whatever that means. It goes into the host cells. The LNPs, the lipid nanoparticles, the synthetic nanoparticles protect the RNA from degradation by RNases and enable transfection of host cells after intramuscular delivery. Transfection means it goes everywhere. It gets into your cells. It basically your cells absorb this substance, readily absorb it. Okay, and if you wondering what this article is, this is the European Medicines Agency Science Medicines Health, 19th of February 2021, Committee for Medical Products for Human Use Assessment Report. COVID-19 mRNA vaccine, nucleoside modified, nucleoside modified.
Nucleoside modified.
Okay. Assessment report as adopted by the CHMP with all information of commercially confidential nature deleted, with all information of commercially confidential nature deleted, guys. Okay? So they're not telling us the real bad shit.
Assessment report as adopted by the CHMP with all information of a commercially confidential nature deleted.
Deleted. Look how long this report is. But covers all kinds of shit. I'll just go to the table of contents right here. We'll look at the table of contents real quick. We're not going to look at anything else because I looked through here and I found where it said it had the nanoparticles, which are the magnetic nanoparticles. They don't say magnetic, but it's what it is. It acts as two functions. It acts as a preservative for the mRNA, and since it's magnetic, it has to stay cold. And since it degrades in warmer temperatures, the mRNA stuff has to stay cold. It all has to stay cold to work, to stay alive, not to work. It apparently it's not working in a certain percentage of the population or genetic structures. It's killing people. It's fucking doing shaking and where is that video of that kid fucking shaking? I had it pulled up somewhere. Maybe it's on the other one. Fuck, I wonder what I did with that. It was on BitChute. There was a kid. Anyway, we've all seen the videos. We've seen the videos of people. But there's some of the serious adverse event deaths and other significant events. Page 108. We should look. We could look at that real quick. 108. Discontinued due to adverse events. Disease or condition. Importance of favorable and unfavorable effects. 108. 108. Let's check that real quick. Page 80. One oh eight right here. Okay, what's it say? Here we go. It says, let's see if they lay a lie. Among the 19,067 subjects, placebo equals 9,536 placebos. non-placebos 9,531. Then 2 months of follow-up post-dose, 2 small percentages of subjects in the 30 group, 0.6%, and the placebo group, 0.6%, reported any SAEs. And SAEs are serious adverse events. Yeah, they're lying. They're lying. Uh, Wait, hold on. Among all included subjects, 3 SAEs were reported in the SOC immune system disorders, 1 SAE of anaphylactic reaction, and 1 drug hypersensitivity was reported. In addition, 1 SAE of anaphylactic shock was reported in the placebo group. It was strange. Facial bone fracture was reported. Listen to this. After the cutoff date and up to December 20th, additional 22 serious adverse reactions have been reported. Blinded data. Blinded data. They fucking erased it, guys. They're fucking hiding the deaths in the fucking research tests. I knew it. I fucking knew it. I called this out fucking at the middle of fucking 2019 when they started talking about this. They were testing this shit. I knew they were going to fucking hide the shit. And there it is right there. Blinded fucking data right there.
SAEs related to study intervention.
Read it. Or they got some kind of code in there that it won't let my fucking reader read that part. All right. Chill.
After the cut-off date and up to the 5th of December, 2020, additional 22 SAEs have been reported. Blinded data. SAEs related to study intervention. Up to the cut-off date, 4 of the SAEs in the BNT162b2 group and none in the placebo group were assessed by the investigator as related to study intervention. 1 event of lymphadenopathy and 1 event of shoulder injury due to incorrect administration were considered related to BNT16.
Come on.
It is not agreed that the event of ventricular arrhythmia and the event of pain in the lower back /extremities and radicular paresthesia have been convincingly demonstrated to be related to study intervention, since the subjects had underlying conditions that could have caused the 2 SAEs. There is little biological plausibility, and the overall numbers of reported events do not allow for a causal inference.
Yeah, but they deleted data. They deleted data, guys. They deleted research fucking data of the SAEs. 22 of them. 22 fucking severe adverse reactions, which could have been death, which could have meant they fucking died. And they fucking covered it up. They covered it up. There you go, YouTube. There you go, YouTube. Get me for fucking medical advice on this one. I dare you. I fucking dare you. I'll take your ass to fucking court and slap a goddamn dick on your face real quick. Try a Russian accent. No, it won't. Real X Files. You're damn right. Where was that paper at? Um, I need to save that somehow. Where's it at? Oh, here it is. Documents European. This is the best document I've found that had basically given away themselves away. They covered it up, but they have to say they covered it up, kind of like the fucking Illuminati's got to tell you what they fucking did, right? PDF file, documents, new folder. COVID-19. Dirty laundry. Oh. Right. Saved it now, motherfucking YouTube. Now what are you gonna do? You gonna take this fucking video down? I don't think so. I don't fucking hardly think so. If it gets taken down, I'll make another one with this fucking paperwork. Now let's cover magnetic nanoparticles. They talk about it in each one of these articles. Okay, magnetite, polyethylenamine, HCI, is the matrix that is cancerous. That chemical there, polyethylenamine, is cancerous. How do you say it?
Polyethylenamine, HC.
Polyethylenamine, I believe, is cancerous. Let's check. God damn it, I want to fucking... There. HCI. Shit. HCI. Wiki, so it's an official source. That fucking leftists believe anyway. Wikipedia. PEI has a strong toxicity and uses Vancha. However, there is no mention of toxicity in that particular article. See, it's such a convoluted fucking chemical. There we go. HCI does not exist. Motherfucker.
Polyethylenamine, PAY, or polyiazidine is a polymer with repeating unit composed of the amine group and edit. The linear PAYs are solids at N with repeating unit composed of the amine group and 2-carbon aliphatic CH2CH2 spacer. Linear polyethyleneamines contain all secondary amines, in contrast to branched PAYs which contain primary, secondary and tertiary amino groups. Totally branched, dendrimeric forms were also reported. 1. PAY is produced on industrial scale and finds many applications usually derived from its polycationic character. 2. Linear PAY fragment. Properties, edit. The linear PAYs are solids at room temperature while branched PAYs are liquids at all molecular weights. Linear polyethyleneamines are soluble in hot water. Olae ethylenamine was the second polymeric transfection agent discovered. 15. After polyethyleneamines are used in the cell culture of weakly anchoring cells to increase attachment. PAY is a cationic polymer. The negatively charged outer surfaces of cells are attracted to dishes coated in PAY, facilitating stronger attachments between the cells and the plate. Transfection reagent, edit. Polyethylenamine was the second polymeric transfection agent discovered. 15. After polyl-lysine. PAY condenses DNA into PAY has a number of uses in laboratory biology, especially tissue culture, but is also toxic to cells if used in excess. 12. 13. Toxicity is by two different mechanisms. 14. The disruption of the cell membrane leading to necrotic cell death, immediate, and disruption of the mitochondrial membrane after internalization leading to apoptosis, delayed.
Leading to apoptosis. That's what's going to happen to everybody. Mitochondrial membrane, necrotic cell death, internalization leading to apoptosis, which can't be good. Cannot be a good thing. This is what is making people sick, I bet. Listen to this.
Polyethylenamine, PA, is a cationic macromolecule commonly used in gene transfer /therapy protocols with high transfection efficiency both in vitro and in vivo. PA is also cytotoxic, but the molecular basis of its cytotoxicity is poorly understood. Here, we have demonstrated that branched 25 kV and linear 750 kV PA can both induce membrane damage and initiate apoptosis in 3 clinically relevant human cell lines: Jurkat T cells, umbilical vein endothelial cells, and THLE3 hepatocyte-like cells. We have defined phase I toxicity as early necrotic-like changes, 30 minutes, resulting from compromised membrane integrity, assessed by considerable lactate dehydrogenase release and phosphatidylserine translocation from the inner plasma membrane to the outer cell surface. Phase II cytotoxicity, 24H, was due to activation of a mitochondrially mediated apoptotic program resulting from PA-induced channel formation in the outer mitochondrial membrane. This led to the release of propoptotic cytochrome C, subsequent activation of caspase 3, and alteration in mitochondrial membrane potential as a result of caspase translocation into the mitochondria. The reported observations have important implications for the design and execution of gene therapy protocols as well for controlling intracellular distribution of drugs with cationic-based polymer delivery systems. Viral gene transfer systems often induce severe toxicity, and in some clinical situations their use has resulted in patient death. 1. This has led to a surge in the design and engineering of polycation-based synthetic gene transfer vehicles with high transfection efficiency both.
Damn it.
PA
Come on, work with me here. Shit.
login S of
Fucking page isn't working for me. Shit.
Indeed. Ratios similar to this study.
Shut up.
Viral gene transfer systems often induce severe toxicity, and in some clinical situations their use has resulted in patient death. 1. This has led to a surge in the design and engineering of polycation-based viral gene transfer systems often induce severe toxicity, and in some clinical situations their use has resulted in patient death. 1. This has led to a surge in the design and engineering of polycation-based synthetic gene transfer vehicles with high transfection efficiency both.
They fixed this article so you couldn't read it.
Linear and branched polyethylenamine S PAs are among the most extensively studied polycations used in transfection protocols. PA condenses DNA into toroidal and globular nanostructures, which are then amenable to cellular internalization via endocytosis. 3. Although different mechanisms have been suggested, it is generally believed that following internalization, polycationic vehicles destabilize endosomal membranes or act as proton sponges, buffering the low endosomal pH and inducing membrane rupture.
And Twitch. I think you and snooze button on YouTube. Now, where was I at? Where was I? Oh, yeah. So anyway, we know that chemical causes death on its own. And these are just some of the other articles I found about stuff. This is the Dr. J and Ruby about the video. Same, there's a link to the same video. I'll let you guys listen to part of it. It says the force delivery system is called by the acronym of SPIONs, supermagnetic iron oxide nanoparticles. These particles usually
Etted within the body. It is a force delivery system and is called by the acronym of SPIONs, supramagnetic iron oxide nanoparticles. These particles use a lipid nanoparticle envelope to gain entry into the cells. It is done this way to protect mRNA because mRNA is easily degraded, and this is also why the Pfizer vaccines are refrigerated at -70 degrees Fahrenheit as another form of protection. There is a German company on the internet called Chemicell which sells different chemicals which can make these magnetic fields around your molecules. You can buy 200 microgram vials of their product called Polymag. These are developed and sold for research purposes only and are not to be used for human diagnostic or as a component of any drug intended for humans. However, at least Pfizer and Moderna are using this substance in their vaccines. Categories.
Here's Chemicell magnification.
Transfection trademark symbol is generally applicable for adherent cells and has been tested with a variety of immortalized cell lines and primary cells listed below. If a particular cell type or cell line is not listed, this does not mean that transfection trademark symbol would not work. Also, for the cells listed, some reagents have not been tested so far, as indicated by ND. Not determined. The Combi-Mag reagent can be combined with any polycationic and lipidic transfection reagent, and also with adenoviral and retroviral vectors. In some cases, references are made in the footnotes to very successful combinations with commercially available reagents that have been tested so far.
And the Polymag hasn't been tested for adenovirus or retrovirus, which, or I would imagine this coronavirus sits in there somewhere. So they are ineffectually really are testing this on us. Look at all the not determined with the Polymag. Champ. Isn't that neat?
Transfection trademark symbol is a novel, simple and highly efficient method to transfect cells in culture. It exploits magnetic force exerted upon gene vectors associated with magnetic particles to draw the vectors towards, possibly even into, the target cells. In this manner, the full vector dose applied gets concentrated on the cells within a few minutes so that 100% of the cells get in contact with a significant vector dose. This has several important consequences. Greatly improved transfection rates in terms of percentage of cells transfected compared to standard transfection. Up to several thousand-fold increased levels of transgene expression compared to standard transfections upon short-term incubation. High transfection rates and transgene expression levels are achievable with extremely low vector doses, which allows to save expensive transfection reagents. Extremely short process time. A few minutes of incubation of cells with gene vectors are sufficient to generate high transfection efficiency, compared to several hours with standard procedure.
Warp speed. Operation Warp Speed. Based on your favorite it allows you to create your own magnetic gene vector based on your favorite transfection reagent. Mouse, mouse, rat, rat, human, human, human. Humans, humans. Yeah, they test on humans. Down here they test on mouse. Rats. Rats, monkeys. Canine, catfish, cetipus. That's what they get this the source from. Look at that. There it is, Polymag for sale. 95 to 105, $25. Boy, they're playing it. Pretty penny for this COVID shit. Why don't you call them up and ask them if Polymag is safe to inject in you? There's their number. Berlin, Germany. Go figure. Fucking Germans. This goes on for fucking ever. See, the polyethylene will kill you. The matrix, the magnetic core is magnetite. I know that's not supposed to be in your body. Health 1 hazard identification. Oh, look at this. Oh, look at this. I got it right here.
Could cause eye and skin irritation. Exposure may cause irritation to mucous membranes and upper respiratory tract. May be harmful if swallowed. Chronic effects, Prolonged or repeated exposure to reagents may cause adverse reproductive effects. May cause fetal effects.
Yep. They're sterilizing everybody. They're sterilizing everybody. I got it. I got it right here, buddy. I got it all right here. We're going to court with this shit. I got it all right here. Char, motherfuckers. Saved in this computer here in my hard drive. Nobody's gonna get it over my dead body. We know what magnification is. Okay, it's even in fucking Deutschland. It's in fucking whatever language that is.
So let me share something else with your audience. There's a company on the internet, and one of many, by the way. I've been doing all my digging. It's called Chemicell. It's in Berlin, Germany. They advertise, Stu, all kinds of products. There are hundreds of components that you can use to create these magnetic fields around your molecule, right? You can buy it in 200 microgram vials. It's called Polymag. And I want to share with your audience the disclaimer on Chemicell's website in case you want to buy a little bit of these magnetic fields. And why would we believe them on the magnification? They've said, please PubMed.com, the magnetofection. Anyone can look up magnetofection. Look at it on PubMed.gov. That's the government's website for peer-reviewed scientific journals. And you can look at the preclinical research and see what they've done, and that it is real, and that when they've used it in animals, they've had very, very negative results. And they've said, please proceed cautiously if research advances toward human research.
She impresses me so much every day also with her diligence in getting back to everybody. I don't know how you find the time. Her private and encrypted secure Proton email, Dr. Jane Ruby at protonmail.com. You can also find more on her at drjaneruby.com. Dr. Ruby.
Here's the link if you guys want the link to this video. This is following up this stream here. Yeah, I can't sleep after fucking watching that shit, man. That's terrible. There's the link to that video if you want it. Well, guys, I don't know what to tell you. But I did dig up all kinds of articles on it. I couldn't save it. Magnetic nanoparticles. Let's get this. I've got saved everything I needed. So I'm just gonna fucking bam, get rid of all this shit. Quite frankly.
All right, first one. Meanwhile, event that's come. Get for you what I got.
Okay. So anyway, I'm going to leave you with some untraditional music. How do you like them apples? that's my report. There's the video on it. I guess I should have put it up on the screen too. It's up on the screen chat. I'm gonna try to get some sleep. I don't believe human beings can do this to one another on a mass scale, on a global scale. It just leaves me fucking, what dimension did I fucking wake up in, man? Not only. Peace out, motherfuckers. Mr. Mission Control's out of here.
Wow.